So now we will welcome Mr. Dulan, who will present us proficiency-based training. Sorry, Mrs. Dulan will present us proficiency-based training for robotic surgery, construct validity on workload for 9 inanimate exercises.
My name is Genevieve Dulan, and I am the Robotic Surgery Research Fellow at UT Southwestern. And today I will be speaking about the construct validity of 9 inanimate exercises for robotic surgery. I have nothing to disclose. Today there's more than 1,000 Da Vinci robotic systems in the United States. In order to work this system, the surgeons need to learn how to dock the robot, to manipulate the manual controls, and to work the foot pedals. It is intuitively difficult to maneuver. The literature review that we did retrieved 35 articles with inanimate, animal, and virtual reality training programs that were not standardized or validated. And our university leaders asked us to create a training program which can train multiple levels of learners, a high volume of trainees, at a low cost, and that is standardized and validated. So we implemented this curriculum in August. So we interviewed 6 expert surgeons, had looked at 10 live robotic cases, which drilled us down to 23 unique skills that we thought were important for robotic surgery. Our curriculum consists of this online tutorial, as you can see, by Intuitive Surgical themselves, our half-day interactive hands-on session, and the 9 inanimate exercises. We have previously described preliminary results which supported our content validity and our feasibility. So these are our 9 inanimate tasks. Peg transfer teaches the gross motor movement. Clutch camera movement is teaching the movement of the camera around a flat surface as an obstacle course. Rubber band transfer teaches the wrist articulation. Teaches the wrist articulation of the robot. Simple suture teaches the basics of suturing and knot tying. Clutch camera peg is just an advanced form of peg transfer. Stair rubber band transfer teaches depth perception and incorporates the wrist articulation. Running and cutting rubber band teaches the use of the 4th arm in cutting. Pattern cut teaches fine cutting. And then running suture teaches the advanced suturing and advanced knot tying. So our aims were to evaluate the construct validity and the workload of these 9 exercises. And construct validity is defined as the score that can detect the difference between experts and novices, and this is essential for proficiency-based training. Workload was defined as the effort required by the trainee to complete each task. We had 8 expert robotic surgeons, 4 novice trainees, and the protocol we used was that they watched a video tutorial. They were allowed 1 warm-up to get used to the system since our novices had never seen the system before, and then they did 3 to 5 consecutive repetitions of each task. Then they were scored by direct observation, and this score was calculated by the cutoff time minus the completion time minus the sum of error multiplied by a weighted constant. This is the NASA TLX workload rating scale that we use to evaluate these 6 areas for workload: mental demand, physical demand, temporal demand, and performance, effort, and the frustration of those of the trainees. So our experts had on average 151 robotic cases with a large range among them, and all had prior robotic training in some sort. Our novices had not seen any more than one robotic operation, and they had no prior robotic surgery training. For our experts and novices, we had a significant difference in their composite score, which looked at all 9 tasks summed together. And for our workload, our average between the novices and experts was not significantly different. This is the graphical representation of our surgeon performance. Orange is experts, green are our novices. And across all 9 tasks individually, there is a statistical difference. And again, for the NASA TLX workload rating scales, the experts are orange, and the novices here are gray. And there is no statistical difference, although you can see the trend on task 4, which is our suturing task, and task 9, there is an increased workload for our novices. So we got lots of positive feedback from all of our participants on these tasks. Construct validity was strongly supported in our composite score as well as each individual task. And this allowed us to take our average expert score and then in the future training, use it as our proficiency-based goal for trainees for our residents after this. And the NASA TLX data indicated there was comparable workload for our experts and our novices, and importantly, the individual metric of frustration was low for both groups, experts and novices. So in conclusion, objective performance metrics over all 9 exercises demonstrated construct validity. Workload was similar for experts and novices, and frustration was low in both groups. And so these data suggest that all 9 tasks are suitable for proficiency-based robotic training. Thank you very much.